I wouldn't insult the people working in the health service by saying you've got to work harder. They work as hard as anybody, and many work much harder. Nor would I insult them by saying you've got to work smarter. It's the system that hasn't allowed them to perform. And we're about changing that. And the underlying principle of the health policy is that people are treated at the lowest level of complexity that's safe, timely, efficient, and as near to home as possible. And really what I mean by that is I don't want patients being seen by consultants who should be seen by their GP. And I don't want the GP seeing patients that the nurse could be seeing. And I don't want nurses looking after patients that healthcare assistants could be looking after. It's all this area within our system that historically people have been jealous to hold on to, when at the same time saying they're so busy they can't cope. So let's make sure that the appropriate professional is looking after the appropriate patient in the right place at the right time. I think when we think of the health services, we very often think of the Department of Health and the HSE, and we forget about the third leg of the stool, which is critically important, and that's private health insurance. I've made it very clear to the board of the BHI that I want a real focus now on cost containment. It's another astonishing fact to me that whilst we've had audit, which clearly needs to be much more robust, in other words, somebody goes into hospital, has treatment, that what the BHI or other insurer pays for is the treatment they got, because I still hear anecdotally that that's sometimes not the case. But what we've never had to date, which astonishes me, is we've had no clinical audit. In other words, no one to go down and challenge the cardiologist for doing that test. And there's no point in sending an orthopaedic surgeon down to talk to a cardiologist or vice versa. You've got to have a similarly qualified professional to go down and say, no, hold on a minute. From a protocol point of view, that did not appear to me to be necessary. And if we're not paying for it, and indeed if you do that again, we're going to fine you. There has to be consequence for people within the system. There hasn't been enough of that. Equally, why do we still pay the sort of fees for procedures that used to take 2 hours, when now with modern technology they only take 20 minutes? And then the last area I want them to address, and we've got a role within the public health sector here on this one, we're going to stop charging the insurers per day, and we're quite prepared to sit down and talk to them about charging per procedure. So the hospitals that are efficient will do well, and those that aren't won't, and the pressure will be on for them to change their ways.